Hello there, my fellow epilepsy warriors and my seizure warriors, my purple epilepsy warriors, and everybody that's wearing purple. Well, as you guys know, my channel is My Brain Wreck, and I just recently been diagnosed with epilepsy, and I'm still going to get my 48-hour ambulatory EEG pretty soon here. I think it's the next week, I believe, once I go get this stuff to be outfitted with and all that stuff. So, what I'm going to talk about today, I'm get off my information from epilepsy.com and stuff. So, if you're wondering if you see my eyes look over that way, that's because that's where I'm looking at. So, sorry about adjusting the camera here. I'm going to try to look and read at the same time here. Well, not at the same time because your brain's only designed to do one thing at a time, technically. So, epilepsy and OCD are they related? Well, that's what I'm going to talk about here in just a little bit. Well, not a little bit, but just want to make sure everybody's out there doing okay, and hopefully none of you guys had any seizures today. If you did, I'm sorry. Or if you found some answers to your things, congratulations. Or if this is brand new to you, a place to go check out is epilepsy.com. That's a great place. That's the main foundation. And it can lead you to your own counties, states, and stuff. This is mostly for the United States, of course. I'm not sure what other countries have. I think Canada has their own epilepsy foundation, I believe, and I believe London, the United Kingdom, does also. So, I say thank you to all my subscribers out there. Appreciate that. All right, I'm at 5 subscribers, so that's good. So I'm happy with that. To me, it's not about the subscribers. It's about me trying to get information out there for those who are trying to understand epilepsy just like I am and still learning about it and different things. Not just to realize epilepsy and seizure are two different things, even though there's a seizures associated with epilepsy, but it could be two totally different things. You just have a general seizure disorder. Generally, I myself had nocturnal seizures, 3 of them so far. So they've been under control for a little bit. So I'm doing good. So we're going to talk about epilepsy and OCD. So I know a little bit about OCD because I have a relative that has OCD, so I know what they go through and why. So OCD, Obsessive Compulsive Disorder. So Obsessive Compulsive Disorder. It's a type of anxiety disorder in which a person repeatedly dwells on unwanted ideas or feels compelled to perform rituals to relieve attention. So you can be obsessive or you can be compulsive. You can have them both together too. Some maybe do compulsive, some maybe just focus on obsessive. They're obsessed with something, just obsessed with that. Or have a compulsive to do something right away and do it. An obsession with something is, they can be, or they can have them combined, like I said. So we'll start. So obsessive compulsive disorder, OCD, is a type of anxiety disorder in which a person repeatedly dwells on unwanted ideas or feels compelled to perform rituals to relieve tension. All right, so what they want to do is relieve tension because it's bugging them. They can't get it out of their head or anything like that. By the way, this is for information purposes only. All right, I'm not a medical professional or anything like that. If you want to understand more about OCD and epilepsy and stuff, all right, you can go talk to your medical profession. All right, I'm not a doctor. My background is in criminal justice. All right, so but yeah, a question about criminal justice you want to put in the comments here, feel free to ask me. So the behaviors happen frequently enough to disrupt the person's life. Well-known examples of such rituals include continually washing one's hands and checking dozens of times to see if the door is locked before leaving home. So, and for those that have OCD out there, I do understand how you feel. Whatever, I know I'm not in your head, but I understand because I know somebody that has it. It's a relative of mine. So, and I deal with it quite a bit often. So, but I'm used to it, so it doesn't bug me at all, really. Obsessive. All right, talk about obsessive. Compulsive symptoms occur in a wide range of neurological and medical disorders other than epilepsy. It may appear in patients with a variety of diseases affecting the basal ganglia, such as Parkinson's disease, Tourette's syndrome, and Huntington's disease. Very interesting. I did not know that. So, it may occur after some kinds of head injury or may be part of some illness that causes progressive dementia. So, what it sounds like people that may be diagnosed with it are just the obsessive part. If they had a brain injury in the past or something, maybe cause them to somewhere up there in their brain just to focus on being obsessive to certain things, or it bugs them if they're not going to check on it or whatever. Being obsessive about it, I believe. So it may occur after some kinds of head injury or may be part of some illness that causes progressive dementia. So there might be a link there somewhere between. Obviously, they must see something there somewhere. So OCD is uncommon. Some would say rare in people with epilepsy, but there does seem to be a connection, according to epilepsy.com. OCD is the most often in those with complex partial seizures. All right, so they have partial seizures. I believe those used to be called grand mal seizures, if I'm not mistaken. They just switched to partial seizures, originating in the temporal or frontal lobe. Up here. Or seizures originating in the anterior cingulate gyrus near the corpus callosum, which is somewhere up here, I believe. Like I said, this is for informational purposes only, not medical information, but information purposes only. All right. And I'm learning this as much as you guys, and some of you have had epilepsy for a long time, probably got it down to a T. Although it's unclear why OCD tends to occur with epilepsy, evidence of the association is quite convincing. So obviously they have some type of convincing evidence that it's linked together, possibly. So according to epilepsy.com, early studies suggest that epilepsy caused certain personality characteristics develop, including obsessional traits. So obviously there's some traits that develop from epilepsy and cause personality characteristics develop within their OCD. It says some evidence suggested an increased likelihood of a general personality disorder and epilepsy. All right, so they have a general personality disorder. Very interesting. It's interesting to know that. So that's something new to me. Excuse me while I take a drink here so I don't cough everywhere. Others found that different types of epilepsy may be associated with different forms of abnormal thinking or behavior. And this is a well-known article by Waxman and Geschwind, 1975, that's the year I was born, suggested that temporal lobe epilepsy could be linked to a specific behavioral syndrome. Obsessional traits were described as an additional component of this syndrome, as the OCD. Here it says many have felt that symptoms of OCD might occur as a result of generalized personality factors associated with epilepsy. Wow. So, like I said, this is new to me. I did not know this. So, if you want to look for information stuff, like I said, epilepsy.com is pretty neat. Has lots of articles on there that you can read and stuff. Some of the articles are old, but some of them are coincide with today, what's going on with the medical things. So, a number of studies published in the 1980s and 90s report a more specific association between OCD and epilepsy. Most of the evidence linking OCD with epilepsy has come from case studies and clinical observations, and not from studies of large groups. It says in most cases, the patients did not show obsessive compulsive symptoms before the onset of seizures. So they didn't show anything until after they had an onset of seizures, and then they noticed that people were having some type of obsessive compulsive things, possibly. So maybe that's why they suggest there's a strong link between OCD and epilepsy. So before they even had epilepsy and stuff like that, there's an OCD factor that was in there somewhere, or vice versa, I'm guessing. Now here it says some have suggested that in some people with epilepsy, OCD may be a form of forced thinking, new thoughts that intrude into patients' awareness at the onset of a seizure. This behavior may also occur without seizure activity. So what they have is intrusive thoughts, what to come in, was like a thought after a thought. So let's say like this, intrusive thought. I just hold my earbuds and I put it down. Then another comes in. Oh, here's my water right here. And more thoughts just keep coming in. More intrusive thoughts. Then it comes back. Here's my sunglasses. Then again, it repeats itself and it's like, oh, Okay, there's one of my earbuds. Now you can see I have my earbud in here. By the way, if you want to have my earbud in, I'm listening to a scanner, app scanner, or whatever. So, oh, and then again, there's my water. There it is. And vice versa, or so forth. There's my sunglasses. You guys get the there's my sunglasses. You get the idea. True see thoughts, it's a cycle. Now, this is some investigators have tried to use the connection of O.C.D. with epilepsy to look for information about the mechanisms underlying each disorder. So they try to use connection between O.C.D. with epilepsy to look for information about the mechanisms underlying each disorder. So obviously there's some type of connection there somewhere where it affects the epilepsy. Like I said, the partial seizures or whatever, the grand mal seizures, I believe this used to be called. So it's hard to say what's going on with that. That I don't know. I'm not sure. I'll have to do some more research on that. Now, the most widely proposed theory suggests a kindling effect, in which seizures localized to one area of the brain stimulate another area, such as the limbic region. I don't know where the limbic region is. I'm sorry. Like I said, I'm not a medical professional, but if you guys understand your brain really good, congratulations. Leading to the emerge of obsessive compulsive behavior. So I'll read that one more time. The most widely proposed theories suggest a kindling effect in which seizures localized to one area of the brain stimulate another area, such as the limbic region, leading to the emergence of obsessive compulsive behavior. So, other things down here, it says somehow documented that epileptic discharges from frontal and limbic brain regions make patients particularly susceptible to this type of behavior. So when it's discharged, from a seizure or something, maybe they have somehow it's caused their O.C.D. to act up and be more active, I guess you could say. Supposedly, I'm guessing. I don't know. Like I said, I don't understand this totally, so it's new to me about O.C.D. and the epilepsy being related. So I was totally unaware of that. So very fun, very not funny, but because nothing funny about epilepsy or O.C.D. at all. Everybody, we're all here in this together. So like some of you out there, let me know in the comments if you have O.C.D. and epilepsy. I'd be very interested how that coincides with each other. Does it affect one versus the other, or the other way, or does it affect you more? Does it traumatize you even more, or so forth? Now it says others have, some have noted symptoms occurring solely after areas of the brain have been removed in epilepsy surgery. So that's interesting. So they move part of the brain, mostly I think it's on the left side of the brain up here where they move most stuff or whatever. I can't remember what it's called. I took a psychology class and they have you study the brain, because you got to know where stuff, how you think, or, you got the left controls the right, left controls the right, and the right controls the left, and then, like I said, my brain took a wreck, so I called my brain wreck, and everything went crazy, nothing was communicating for my nocturnal seizures. Now, it says others have seen a link between O.C.D. and seizures originating from the left cerebral hemisphere. Evidence supporting these theories is mainly speculative at this time, however. So it's just speculative at this time. But this is from the 80s and 90s and stuff. This was from 1975 when this stuff was written or thought about. This is a reference. This is a Waxman SG, Geschwind N, the interictal behavior syndrome and temporal lobe epilepsy. And then Gen Psychiatry 321580-1586, 1975, PMID. You guys probably know what those mean, so it's just a reference number. 1200777 and so forth. So this was authored by Andreas M. Kanner, medical doctor, Keren Isaacs, MPhil on Friday, February 4, 2002, and it was reviewed by Patty Osborne Shafer, registered nurse, Minnesota, I believe. I know, or MN, excuse me. Master's of Nursing, I guess, on Thursday, August 22nd, 2013. So I'm going to highlight those and all that so like you guys can gather references to that. Because that's where the credit stuff goes to. Now here, the next thing talks about stress. So I'm gonna get to stress here too. We'll talk about stress. I'm gonna click on the next page and talk a bit about stress here. So right here, so stress is a very important thing to talk about and listen to your doctors, nurses, and medical team about. Obviously, for those who have epilepsy and need the rest and stuff and all that good stuff and taking your medicines. So although seizures can't always be predicted or controlled, there are things you can do to lower the chances of having one. Your actions also have the power to increase your chance of having a seizure. So if you're doing something you're not supposed to be doing, which I know a lot of people do, and I can't say I haven't either, like I sleep, I gotta make sure I sleep. So I don't sleep, more highly likely I'm gonna have seizures. And for those people for you that are out there that have epilepsy and stuff or are new to this, one of the most important things doctors tell you or neurologists stuff is say, make sure you get rest. Absolutely. I do get rest, but my seizures are nocturnal, so nocturnal seizures can be one of the most deadliest. I can just die instantly in my sleep. Like I said, my last seizure, I was on a ventilator. I'm not sure how many hours. Did not come to until the next day. And by the way, all three of my seizures, nocturnal seizures I was turning blue. And CPR had been done on me all three times. So I see I'm a man of God and faith. So that's why I have this Jesus cross here. But I also believe in him. God gave me life and Jesus Christ died for my sins. So that's why I thank him for. So many people with epilepsy say that increased sleep deprivation, increased alcohol consumption, and menstrual changes lead to an increase in the seizure frequency. So for you women that have the menstrual, but you guys can't control that, of course, because you guys have it every month, and when it's time for you that time, it's what happens, unfortunately. And I'm very sorry for that it happens that way. You probably already knew that. What you may not know is why. The reasons that all these situations change your brain's excitability. Your brain is very sensitive to these changes, and if there's a big enough change from normal, you may begin to have a seizure. So for those that have sleep deprivation and alcohol consumption, especially people that are drinking alcohol, you can go what's called an alcohol seizure. And I don't know if you guys know that or not. And you're killing yourself, or you could die just that day just from drinking the alcohol and having a seizure at the same time. And the reason, as I said, all these situations change your brain's excitability. Your brain is very sensitive to these changes, and if there's a big enough change from normal, you may begin to have a seizure. So, another thing, emotional stress also can lead to seizures, which obviously with your epilepsy and stuff, because it's traumatic, not just for you, for your family, and you've been through a lot, and your body's trying to recover itself, and you don't know what's happening. And for those that are new to this, yes, it's scary. It can be scary because you don't know. Right? What is this thing? Why is my brain doing this? The reason your brain sometimes has seizures and things like that is to actually protect your body in some ways to certain things. Not always, but in the other, also your body doesn't know how to react because something's not clicking up here right. So emotional stress can always lead to seizures. Emotional stress is usually related to a situation or event that has personal meaning to you. Maybe a situation in which you feel a loss of control, In particular, the kind of emotional stress that leads to most seizures is worry or fear. Now, with people with O.C.D, a lot of them do have worries or fears, Well, sometimes some of them don't even come outside. And I forget what that's called, but they don't. This is one study found in some patients, anxiety, another term for worry and fear, led to hyperventilation, overbreathing, and an increase in abnormal brain activity and seizures. Other emotions that have been linked with stress and seizures are frustration and anger because they're so upset, they don't know what to do, how to control it, what's going to happen to me, why did this happen to me, who's going to help me, who's going to be there for me in need, are the people going to still like me, are they just going to ignore me and thinking I'm faking this, or doing this on purpose. And unfortunately, there are people out there that are like that, thinking you're faking stuff and you're just doing it on purpose to get attention. But in reality, no, it's not true. You're actually having a medical issue, medical problems going on. Sometimes the stress is a major event, but most often people report a buildup of daily hassles or stress. So it could be from work stress, just hassle in general in society with people, you know. Maybe you don't like this person or that person don't like you or you don't agree with that person and then they try to get your goat, try to get you up and raise your stress level and you're going up and up and up and up. So the question is, how can I decrease my chances of having seizures from stress or worry? Well, there's a number of things you can do. There's a few things to do. It's not guaranteed it's always going to work, but it might help you lower it, you know, lower it so you won't have it. So regardless of the cost, probably the best way to decrease your seizure frequency is to follow your medication schedule very closely. So take them at the same time consistently every day. No, I'm not gonna say I miss my medicines at not at the correct time. I have. When one time I took my medicines and I thought I didn't take it, I took it again. I'm like, oh boy, thank God I was okay though. I called the pharmacist. We called the pharmacist because the pharmacist, pharmacists know a lot about the medicine stuff. It's 24-hour pharmacy. Thank God. So you should be okay. Just make sure you do what you need to do, whatever, set up for a while. And if you feel like feel funny or anything like that, just call 911 or go to the emergency room if you need to. So when in doubt, call 911 or when in doubt, have somebody take you to the emergency room, okay? Now, that's part of my background criminal justice from learning my dispatch classes. When in doubt, call 911. People should call 911 no matter what. No matter how small it is or how little it is. You'd rather be safe than sorry, all right? Because sometimes if you're in doubt, call 911 because sometimes you never know that small little thing could save your life by calling 911. When stress or worry is a trigger, there are a number of things you can do to lessen the chance of a seizure. So, the first thing is, how is that affecting you and how are you coping with it? How are you coping with the stress? How do you want to cope with it? Is there a simple way you can do it? Is there a way to lessen its impact out to you? Are there ways to manage stress better? Yeah, there's lots of ways to manage stress better and stuff like that. I mean, you can also get a counselor or therapist, or somebody, talk to a friend, family friend, member if they're willing to listen, or a shoulder to lean on or listen to, or ear to listen to. That's one way, in my personal opinion. Just talk it out, let it out. If that person's willing, they're a good person and understand what you're feeling, what you're going through. Are you having sleep problems? Difficult sleeping is a common symptom of stress and mood problems. So, because you're having trouble sleeping and stuff, yeah, your anxiety, your stress and stuff is going to be totally different. It's going to add it up, and you just want to grab something and go, I can't sleep or do nothing. You're tossing and turning and getting woken up by the littlest thing. I myself get woken up by the littlest thing, no matter how small it is or whatever. I do try to get my at least my 8 hours. Try to get 8 hours of sleep the best I can. Sometimes I'm in there for 12 hours, but also that has to do with my medicine and stuff I take on very high doses of medicines. So, since sleep deprivation is a common seizure trigger, it's important to pay attention to sleep at these times. All right? Are you eating normally? Are you eating foods and stuff that are giving you too much excitability, stuff like that? Are you eating too much sugars and things that sugars in your body? The sugars, when you're going to get that quick high, but what's going to happen to you? You know what's going to happen to you. That sugar level and stuff or whatever, it's real quick high and stuff. Is going to come dropping down real fast. All right. I myself type 2 diabetes, so I really, really do have to be careful what I do. And to be honest, I'm not always careful what I do. So, and I have to watch my carbs. I definitely have to watch my carbs. They prefer your A1C. I'm not sure. Be down, I think down to a 4 or a 5 or something, maybe 6 at the highest. Mine right now is a 7.2. At one point in time, it was at 13. So I got it down quite a bit. I'm not sure what it is right now. So it says, are you eating normally? Eating habits often get disrupted when people are feeling stress. When you're stressed, it's like, I just want to eat this, and this. Because you're trying to forget about what happened through the day and stuff, and now just to fix it and try to numb yourself. Some people eat more, others don't eat or have poor eating habits. Some people find that they have more seizures when not eating well or going long periods without eating. Maybe you're drinking too much coffee or caffeinated beverages. Caffeine is very, very much a trigger for seizures. It's a stimulant. There are decaf coffees, yes, you can have. Right? Doesn't mean there's a trivial amount in there. There's going to be a trivial amount of caffeine in it, but it's going to be less. This can worsen seizures by disrupting your sleep. So now, is alcohol or using recreational drugs a problem? It's hard to say, like recreational, like marijuana, does it help you? Does it, I mean, I understand that people are going to use it and stuff. It's legal in quite a few states, legal here in Michigan, because it's funny, from where I live, just down the road around the corner for me is a, just not just Michigan, but it's called high society. So is alcohol or using recreational drugs a problem? Sometimes substance use or abuse is a problem when people have mood problems or are feeling stress. Not a good idea if you have seizures. Some people are more likely to have seizures during or after alcohol use, and many recreational drugs can worsen seizures. So they can, they've done studies on these, that's what it does, and so forth. So as we come to the end here, what can you do, or what can I do? What can you do for yourselves to try to help yourselves understand yourself better? Well, like I said, if you're willing to get help, if you can afford it, find a therapist. If you're in school, talk to your school counselor or a counselor in college or whatever, advisor, whatever they may call them. Even at church, the church pastor or anything like that. I myself am ordained, so I try my best to talk to people, and to help them understand. I'm not perfect. Never complain to be perfect, because I am not perfect. The only perfect man is the big guy upstairs. All right. So that's what I believe in. I'm not here to force my judgment on you or anything like that, or force my beliefs on you. That's you believe how you want to be. That's why God gave us free will. So what can I do? Well, what can you do? Identify possible triggers and consider what you can do to modify or change your lifestyle or behaviors. The goal is lessen your chance of seizures. We all want to lessen our chance of seizures. Look at self-management strategies to manage triggers of seizures. Linked to managing my epilepsy. Here's just a few ideas. Start and continue a regular sleep pattern. All right. Go to bed at a time that you usually go to bed to and wake up. I know there's some of you guys out there work a lot, and it's hard for you to sleep and stuff. You're like, go sleep, but it takes you a while to fall asleep, right? And you're like this, and you look up, you look at the clock, you're like, you're sleeping again. You're trying to sleep, and then you look at the clock on your phone or whatever, your alarm clock next to you. It's like almost impossible. One suggestion I have is maybe one of those mood things, calming things, maybe that might help you, maybe not. It's just a suggestion, that's all it is. So try to go to bed and wake up at the same time every day. Definitely limit your alcohol consumption to a few or no drinks, and don't drink too often. Even though some of you people think it doesn't affect you or anything like that, maybe it doesn't. I don't know. Like I said, I'm not a medical profession, so I'm not in your shoes. I don't know how your body reacts. Find out an outlet to help deal with your anger. Do you like to box, kickboxing? Do you like to exercise, walk, take pictures, do videos like I'm doing here, a YouTube thing that helps you? Frustration and worries in your life. Exercise, music, conversation works for many people. Even if you just talking to anybody, just a stranger on the way or something, if they're willing to listen to you. I know it sounds funny, but or your friends, families, and anybody. Counselor, a pastor, somebody ordained like me. I don't consider myself a pastor or minister, but I just consider myself ordained. So that's what I suggest, is that you do that. But I hope this helps you. Some of those that are struggling with epilepsy or O.C.D. that's associated with epilepsy, which, like I said myself, did not know that. And so, very interesting. So, that's something new I learned. So, hopefully, maybe something that you learned. And like I said, if you want to learn some of this stuff and get tips and stuff or whatever, or understand what epilepsy is all about and try to learn, there's lots of good articles in here on epilepsy.com. All right. So, go check it out and see if that helps you. Well, guys, I hope you enjoyed this. I know it's long, and so for those who find this interesting, I'm glad you're here. And this is meant to pop on your feed. Maybe it was meant to pop on your feed about epilepsy and so forth. So great. So thank you for tuning in to my brain wreck. You guys be strong, be seizure free, and have a strong purple warrior epilepsy attitude. Sure you stay positive all the time. This is my brain wreck. If you like my channel, like, subscribe, press that little skull down in the bottom right hand corner there. It's like an x-ray of a skull. And bring a subscribe button that way. And just make sure you click all. That way you know when I post a video each and every time. You guys have a great day. And stay strong, my purple warriors.